Parliament.
Yes.
Has the matter come to your attention in its entirety? Do you have all the facts?
Yes. I've been able to gather actually what happened over there. Uh, my son happens to be a doctor at the emergency facility center. And even though he was not on duty on that day, but he's been able to tell me actually what happened. And after that, I've also looked at the incident from the television, the social media, and other places.
Have you discussed it at the level of your committee?
Yes, as committee members, even though we are recessed, we've given ourselves calls here and there, both the majority side and then with the minority side. And we see it as an unfortunate incident, very condemnable. We see it as um, a situation that must not be encouraged in any way in this country. And we also see it as a situation which is avoidable if we can only act in good faith as a country and understand the root causes of all these things.
I'm happy you bring up the subject of the root causes because there are times when we hear that certain things happen, people get involved in accidents, they are taken to emergency rooms, and there appears to be some inactivity. And then invariably, some of those people die. So, from your perspective as a committee of parliament, what should inform solutions going forward? How do we tackle this as a country to ensure that it never happens again?
Let me first mention that what happened should not have happened at all. What happened is a demonstration of the misunderstanding between relatives and the medical staff at the emergency center or the ward. You see, consultation starts with when a patient is entering the emergency ward. Let me just explain this. I'm a medical practitioner by profession and 32 years experience. The consultation starts when you are about to enter the consultation room or the emergency ward. You are assessed by looking at the person, even before you touch the person, whether the person is breathing, whether the person is moving the extremities, whether he's walking in or he's being carried, whether there's active breathing or no active breathing. All this you can assess it as they bring in the patient. But the resident will know that the doctor has done all this assessment by just looking in their direction. And so after that, after you have been given the bed, the doctors and the nurses have to let you go through the next stage. If in fact, that stage is not carried out, most often they have little to do because even the type of IV fluid that you have to set up, if the BP has not been done, you might not be able to identify which particular drip. You will call it drip. You will call it water. I don't know, the IV fluid. If the BP has not been done and by the nurses, the doctor cannot even order the type of IV fluid that should be set up because some of the IV fluid, they are salt water. Other IV fluids are glucose. And if you have got BP and we set up salt water on you, we'll be doing more harm than good. So all these things, when you come initially and you have to go through these stages for the doctor to also come and carry out his activity, people see it as a delay. And I must say that sometimes if you go to hospital and you have less than 5 minutes to live, possibly even before we carry out this assessment, you will die. You'll be kicking your legs, but we cannot do anything unless we are able to assess the situation and know which direction we are supposed to take. So
Doc.
let us exercise patience with the medical staff. And I must also say that, well, sometimes we, the medical staff, we seem not to talk so much. We
But
are
is that
people who,
not the root cause of the problem, where there's no communication? So
that,
sometimes you walk into a medical facility, you're even asking questions, and you're snubbed, or your doctor can get angry. Shouldn't
yes,
we
that is
review
true
that kind
because
of thing?
even the talking, there is a way of talking which it's well arranged. Sometimes the person who is supposed to talk might be your boss on the issues. But like I'm saying, it is a matter of communication and sometimes patience. If you talk and the response you get is bad, probably as a human being you might also react, then the banter starts. But sometimes um, I would say that let us communicate more. Yes, both sides, the hospital staff and then the patient relatives. And I have to also say that a lot of patient relatives who come into the emergency ward, it's a big nuisance. It's a big nuisance even for the doctors and nurses who are working there. You have to concentrate. You have to bring out all the things that you have learned for the past. For me, for the past 32 years that I've been practicing, I have to bring everything out sometimes to save a patient. And so you need to be alone sometimes. You need to be there with just critical distance. Sometimes we only need one patient relative to ask about the patient and what happened, and not more than that.
Fair enough. So, Doc, provide a solution, a blueprint going forward. What should be done to ensure that this does not happen again?
Well, of all that has happened, we shouldn't just encourage these things to happen. Um, for them to go around filming the place, putting on social media, and for the comments that have come in so far, I mean, the Nurses Association, I want to plead with them that they shouldn't go on strike on this issue. Let's talk about it and get to the root causes. And then for my friends at the minority, the Minority Health Committee members who are trying to give it a political twist or a political connotation, I advise them that, look, whenever in Ghana you turn something into politics, you destroy the case. And so they should stop that. This is not a case for politics. This is a case that we have to condemn the perpetrators and call on the police to carry out their work. But in the long term, the solution lies in recruitment of more staff. When they got to the emergency, everybody there was working. No nurse or doctor was sleeping. Everybody was occupied. And so if we had enough doctors and nurses at the emergency, with some being standby for new cases, this thing probably would not happen at all. So we should recruit the doctors. For the past 8 years, over 1,000 doctors are now in the house. We've been able to reduce it to about 900. 48,000 nurses are in the house, unemployed. And half of pharmacists, I think they are also around 1,500. And then the allied sciences in tens of thousands. They're in the house unemployed. And this is what the government should work gradually to reduce the numbers. Of course, we cannot use 8 months to correct a situation that they have used 8 years to establish. We need time as a government to correct the situation. Yes. So the MPP should not just come in and try to play politics with it. Some of these things is because of these 8 years of mismanagement in the health sector.
Fair enough. Now, your grouping called for the arrest of the perpetrators of this act. What was the motivation? Was it based on the information that you had gotten or your assessment of the situation, or what exactly?
Come again?
You called for the arrest of the gentleman
yes, they need to be subjected to the process.
Based on what? Based on what you saw?
My minister said that irrespective of the circumstances, he said that they are wrong. And I also believe the same thing, that irrespective of the circumstances, the exchange of words, the insults, those perpetrators are wrong. And so they should be subjected to the process, possibly investigated, arrested, and sent to court. And if that is necessary, yes, the police should do their work. By now, the police should have issued a statement about what they are doing, like how they are doing at Akwetia by-election. You know, the hospital is like a national security zone. You can't come there and be filming the place without authorization. And they did all this. And so they have some questions to answer.
Fair enough. Doc, we'll leave it here. Thank you so much for obliging us this interview.
Thank you too.